I inherited this system. The buck stops with me. I take full ownership, but my job is to fix a broken system that's been broken for decades.
Well, the Canadian Forces painted a very grim picture inside long-term care homes in Ontario and in Quebec. Sick patients not separated from healthy residents, staff not properly using PPE, residents left for hours in soiled diapers, cockroach infestations. The list goes on and on. The Army was called in to help as caregivers. They emerged as whistleblowers. They couldn't even cope with the coronavirus pandemic as they watched it ravage long-term care homes. Experts say the pandemic only added stress to an already broken system that everybody knew about it. How can provinces improve long-term care? Should the RCMP be called in? And in exchange for a promise on sick leave, why did the NDP agree to shut down regular parliamentary sittings until September? Let's find out. We're joined now by the NDP leader, Jagmeet Singh. Mr. Singh, hope you and the family are well. Welcome back to the program. Ontario Premier Doug Ford said the province needs more money to address the major problems in long-term care homes. He says he was stunned when he saw what many people said have been around for years. Do you think the federal government has a role to play, and in which case, what would that be?
Absolutely. There's no question about it. We've heard from the previous health minister, Dr. Philpott, who said absolutely the federal government has a role to play. And I've been calling on the Prime Minister to show some leadership, that it's not enough to say that he's willing to sit back and wait for provinces to act, but the federal government can play a role. And a couple of the key ways that we can play a role, first off, the federal government can increase funding to long-term care. The health transfers over the decades have been going downwards, have reduced to the point that what used to be 50-50 is now 80-20. We can increase healthcare transfers, and we can ensure that long-term care is rolled under the same principles as the Canada Health Act to ensure that we're getting quality care for seniors.
All right, a lot of provinces will say, hang on there. We know it's a shared responsibility, healthcare, but it is provincial jurisdiction. Is this really a problem that the provinces have to deal with, and they just have to ask for, I don't know, what is it, just more money from the federal government? Is that the answer?
Well, we saw the military go into long-term care homes. The situation, the conditions for seniors was appalling. It's not enough for the federal government to throw up its hands and make excuses. It's necessary for the federal government to play a role, to call for things, to say, well, we believe that there should be no profit in long-term care. The military pointed out what you described. Needles were reused. Needles were reused from patient to patient. I mean, these are appalling practices, and it was clearly cited by the military report that staff was afraid to use essential vital equipment because they were afraid of the cost. Clearly, it's become evident that cost and profit should have no place in the care of vulnerable seniors. So we need the federal government to play a role, to call out the problems with profit, to say that they're willing to establish some national standards, some care guarantees, and working with provinces, let's establish those and then increase funding.
All right, let's talk about another aspect. You pressed Justin Trudeau to talk to the provinces about giving all workers 10 days sick leave. He agreed to that, but it is absolutely not federal jurisdiction. Again, this is provincial jurisdiction. A lot of businesses are saying, we don't even got to be careful here. We don't want a one-size-fits-all. How do you know, when could this happen if the provinces don't agree to this? It's just, is this a pie-in-the-sky promise?
Not at all. It's something we can do right away. We've seen that the federal government was able to, because we pushed them, deliver something like the CERB, which has been effective in getting help to people. We want it to be broader and get those who are falling through the cracks, but it's a system that works. What we can do is use the CERB immediately to allow for workers who are going back to work to be able to take paid sick leave. It would be just unimaginable if in a pandemic, when people are getting back to work, that a worker who gets sick has to think twice. Do I go into work, risking maybe infecting my colleagues with COVID-19, or do I stay at home, then not know how I'm going to pay the bills?
So you're saying the federal government should pay for the entire thing? The businesses don't have to pay for the sick leave, the provinces? You're just saying the federal government comes in and they're the ones responsible for this?
Well, I was saying there's a two-phase approach. Immediately, right away, yes, we need to use the CERB or employment insurance or some federal program to immediately deliver paid sick leave in a pandemic so that no worker has to choose between going to work or staying home and not knowing if they pay the bills. Yes, we need to do something immediate. And that's what I spoke to the Prime Minister about, and we had a good chat about how that could be done immediately. The second goal, and what I want to see in addition to the immediate goal, is a long-term paid sick leave for all as a permanent policy in Canada, and that's going to require working with provinces and employers to get there, and we absolutely need to get there.
All right. Well, in exchange for that promise to do that, you've agreed to support the Liberals on their plan on Parliament to have these 2 virtual COVID committee sittings and 2 physical ones. The Conservatives are saying that's not enough. We're in the midst of a pandemic. They're spending hundreds of billions of dollars. We have not had a regular parliamentary sitting, which means opposition day motions, private members' bill motions, all sorts of mechanisms to hold this government to account till September. And yet you've agreed. Why did you agree to that? Is that an abdication of our democratic need for oversight in the midst of an emergency?
Not at all. In fact, what we advocated gives us more transparency. We pushed for 4 days in the House. The government, the Conservatives talked about sitting in the House without allowing MPs that are from further away, that don't have access to Ottawa. They would be completely excluded. Our plan was one where we had a hybrid system for 4 days a week, hybrid, physical and virtual, so that people across this country will have their voices represented. In addition, the Conservatives wanted us to take the summer off and have no accountability over the summer. And we said, no, that's not fair. During COVID-19, during this pandemic, during this crisis, we need to hold the government to account. And so our proposal included sitting days in the summer as well.
But
so
sir, I just want people, let's not get, these aren't sitting with the COVID committee. I just want people, no private members bill, no emergency debates. On June 17th, they're going to have a whole of government committee. They've given you 4 hours to look at what will be the billions of dollars. 4 hours. They've curtailed debate. You've supported that. You've also tweeted out things like, we need to get work on the missing Aboriginal women and girls issue. Very important issue, but how do you have the audacity to call the government to do those things when they can't do it because of your support for the lack of a regular sitting of Parliament?
Completely false. Evan, with all due respect, your frame is completely false. Right now, we have more days, we have more time in question period. I'm actually entitled to 5 minutes, and all MPs get 5 minutes to ask questions. Before, I would get about 30 seconds for 2 questions. Now I have 5 minutes to hold the government to account. So we're able to push the government. When it comes to missing murdered
are you arguing that the
point,
COVID committee is more robust democratically than regular Parliament?
I've got to clarify the falsehoods, though, Evan. We actually have more opportunity to hold the government to account. The government can absolutely move on things like murdered and missing Indigenous women and girls because they have. We have the opportunity to push them to do so.
But what legislation?
Conservatives had no summer sittings.
Hold on.
They had no summer sittings in what they envisioned. That would leave a blank check for the government. We push back. We have summer sittings. We have significant opportunities to ask the government questions, and we can absolutely hold them to account. And the proof is in the pudding. Throughout this COVID-19 committee, we have pushed the government to improve things like the response to CERB. We have pushed to improve the access for students. We've actually pushed to make changes.
Just a second. You're actually making an argument that a COVID committee with 2 virtual sittings and 4 sittings in the summer and with curtailed debate on spending is more democratic than regular Parliament. You think this is more democratic than a regular sitting of Parliament that you could get? Are you serious?
I'm laying out that we, on an evidentiary basis, have more accountability, absolutely, with what we're laying out. Normally, the summers, there are no sittings. We have increased the opportunity to hold the government to account. That's just a fact, Evan. That's just a fact that we have more opportunity to hold the government to account because we pushed for something the Conservatives didn't want. They didn't want to come back in the summer. We pushed to come back in the summer. Yes, having more days of sitting allows for more accountability on a question.
That's just simply I don't want to get into the weeds, but you've given up opposition day motions. You've given up private members bill. You've got. I'm stunned. Okay, so you think
absolutely we have more opportunity to ask questions.
Okay, so I guess by that
only get
logic,
2 questions, 30 seconds each. Now I have 5 minutes to make my case about pushing the government on things. 5 minutes versus 30 seconds. That's a big difference.
But
that's
sir,
more time to push
it's
the
true
government.
because you're the 4th place party.
In addition, we've got summer sittings. That's more sitting.
4.
I'm just giving you the facts. This is more time to hold the government to account. It gives us more opportunity to ask questions, more opportunity to hold the government to account. Absolutely, it does.
Mr. Singh, I got to leave it there. It's a fascinating debate and it's an important one. Mr. Singh, always good to have you on the program.
Always a pleasure.